Let's look, though, now at Belgium, because what we've seen there, it's now overtaken the Czech Republic to be the country in Europe where the virus is spreading fastest, and it's getting critical. There's been an 88% rise in hospital admissions, and more than that, officials are warning that they could soon run out of space in intensive care units. Well, let's go live there now to speak to our correspondent, Shona Murray, who's in Liège, actually. Shona, just give us an idea. How serious is the situation? How are authorities trying to cope?
Well, good morning, Rosie. Indeed, everybody is trying to cope and do their best. I'm here at the University Hospital in Liège in Belgium, where some nurses who are COVID positive have been asked to come to work because staff shortages are one of the biggest problems here. I'm joined now by Dr. Sasha Giesen, who's the head of the emergency department here. Good morning, Doctor. You're welcome. Talk us through how it works that you have nurses who are COVID positive coming to treat patients who are also COVID positive.
Yeah, the problem is that our situation is becoming worse and worse day by day, and we're reaching the critical point. And the problem, our day-to-day problem is to find solutions, beds and staff. And the staff has been our main problem right now, because 20% of our staff members are out because of the COVID. So we know that it's a critical dilemma, because we need to keep in mind the safety and the quality of the healthcare system. But there's a point where there's nothing but a bad solution. So it's the point where we are reaching now.
So when you talk about the ethical, moral decision making, you have to say, we either have a nurse come in here who's COVID positive and take that risk, or have no nurse, or a nurse who's a student. Basically, or something like that.
Completely. We only have done this in emergency right now, but it might become a real problem because of the increasing incoming patients.
And tell us, could this have been prevented, this scenario, seeing as we had such high levels in March and April?
Yeah, of course, but the real problem is about screening, testing, tracing, and isolating people. And this has been so difficult to settle. So it could be prevented for as long as we are doing things like they've done in South Korea. And this is the way you can prevent things from getting like they are now here. But as soon as the contagious is spreading, you're just waiting for the wave to occur.
Right now, you've 42, since yesterday, 42 people in ICU. Of course, that's climbing. Is it continue to climb steadily, or have any of the restrictions of the past 3 weeks or so made any difference?
I don't think so. For the moment, it's still increasing.
And what can you do if they continue to increase? Because you told me earlier that you have around 60 capacity for ICU. You're at 42 and climbing. Obviously you can't send people away. So what's the plan?
The plan is to gather staff and to have more rooms to take care of them. But as I told you, it will be a new ethical dilemma, because the people who will take care of them won't be probably intensive care nurses, and physicians might be not intensive care physicians, but emergency physicians or surgeons. We don't know yet. We'll see.
Just finally, Doctor, is there anything that we know more? We obviously know a lot more about the virus, but in terms of treatment of people, we know a little bit more. Is there a little bit more optimism in terms of avoiding as much mortality?
Yeah, I feel that the main change, is that during the first wave, people were getting put on ventilator as early as they had more than 6 liters of oxygen. And now we have understood that it's not the best option, that the best option is to use systems to provide support, like continuous positive airway pressure or high flux oxygen, and try not to intubate them and not ventilate them as much as possible.
Okay, Dr. Sasha Giesen, head of the emergency department here at CHU Hospital in Liège in Belgium. Thank you very much for joining us this morning. And back to you in studio, Rosie.
Thank you, Shona, in Liège. In France, the death rate due to COVID-19